Okay, let's dive right in. Welcome to today's Explainer. We're tackling a topic today that touches pretty much all of our lives in one way or another, yet it is so widely misunderstood. We're talking about addiction. Specifically, we're looking at how almost everything we think we know about addiction is actually rooted in really harmful stereotypes and discrimination. So our goal today is simple, but absolutely vital. We're going to rely on cold, hard science to separate the myths from the facts. Here's our roadmap for this explainer. We're going to dismantle the stigma in 5 steps. 1. The roots of stigma. 2. Choice and character. 3. The tough love trap. 4. Brain science. And 5. The truth about recovery. Let's jump in. Section 1. The roots of stigma. Before we break down specific myths, we really have to recognize the environment we're operating in. The shame surrounding addiction is greater than for literally any other medical illness. 46 million. Just let that number sink in for a second. 46 million people in America are struggling with addiction right now. It's actually the 3rd largest cause of death in the country. So this isn't some rare, isolated issue affecting a tiny fraction of society. This is a massive, widespread health crisis. And treating it with judgment instead of actual medical care, well, it's costing us dearly. Moving on to Section 2, choice, willpower, and character. It is time for a real paradigm shift regarding who gets addicted and why. So, let me pose a common myth directly to you. Does addiction only happen to certain kinds of people? Is it just a lack of willpower, a moral failing? Take a quick second to consider how movies or society have framed this for you over the years. Well, here is the crucial truth. Addiction can happen to absolutely anyone. It's linked to genetics, trauma, upbringing, but never your character. Think about it. Just like no one chooses to develop asthma or cancer, nobody chooses how their unique brain chemistry is going to react to a substance. Now, this leads us to another question that really challenges our preconceived notions. Can someone with a highly stable job, a successful career, and a quote-unquote good family life be suffering from addiction? The answer is a resounding yes. Success absolutely does not grant immunity. See, many people live in denial because they're professionally successful, or maybe they come from a good home, or they only drink after 5 p.m. But the reality is, a lot of people are just incredibly adept at hiding the severity of their substance use. And why hide it? Simply because of the deep shame and stigma we're talking about today. All right, Section 3, the tough love trap. Let's look at the incredibly dangerous misconceptions families face when they're trying to help someone they love. You have probably heard this advice before. It's like an age-old societal script. Do people with addiction need tough love to change? Are you supposed to cut them off, kick them out, or detach completely just to teach them a lesson? Actually, the outcomes of those actions are starkly different than what society tells us. When we use tough love or punishment, it just makes the person feel rejected and hopeless, which honestly often drives them deeper into addiction. But compassion and positive support? That approach is scientifically proven to encourage change and actually motivate a person to accept help. But I know what you might be thinking. This immediately triggers immense fear for families. You might be asking yourself, if I try to be supportive, aren't I just enabling their bad behavior? This fear of enabling is huge, and it often completely paralyzes families from offering any help at all. So let's clear the air on a massive myth, codependency. It might totally shock you to learn that this is largely an unscientific theory popularized back in the 1980s. It carries a ton of baggage and unfairly blames loved ones who are literally just trying to help. You can't be codependent because the disorder itself isn't biologically real. The fact is, showing love is never a bad thing. There is absolutely nothing wrong with caring for and wanting the best for someone who's struggling. Life-saving interventions should never be denied just to teach someone a lesson. Addiction is a highly complex illness, not a behavioral flaw. You can have a profoundly positive impact on your loved one by setting healthy boundaries and practicing self-care, so you're in a strong place to actually offer support. Section 4. Science of the addicted brain. To truly understand why punishment fails, we really have to look at the biological reality of the addicted brain. Addictive substances literally hijack the brain. Normally, our brain's natural reward pathway requires time and effort, right? But these substances create a shortcut, just flooding the brain with intense chemical pleasure. And over time, this physically erodes a person's self-control.
The urge to use literally gets wired into the brain's deep survival circuits. It becomes as overwhelming as the primal, biological need to eat or drink. It's not a choice anymore. It is a hijacked survival instinct.
Naturally, people hear this and pose a logical fallacy. Well, if addiction is often treated behaviorally, with therapy, doesn't that prove it's just a behavioral problem and not a real disease? No, that is completely false. All human behavior begins in the brain. Advanced brain studies show us that treatments like psychotherapy actively change brain function. I mean, think about depression. It's a medical illness, often treated with behavioral therapy and sometimes medication. Addiction is exactly the same thing. It's a highly treatable medical illness, and behavioral therapies actively repair those damaged neural pathways. Finally, Section 5, the truth about recovery. What does getting well actually look like? Let's start with perhaps the most pervasive and honestly the most dangerous myth of all. The idea that people have to hit rock bottom before they can finally get well. Waiting for a so-called rock bottom is incredibly dangerous, and way too often, it's deadly. The earlier someone gets help, the better. It's that simple. Early intervention means they still have vital resources, like a job or a supportive family to lean on. Look, you wouldn't wait for stage 4 cancer to start chemo, right? You absolutely shouldn't wait for rock bottom to treat addiction. If you compare addiction to type 2 diabetes or hypertension, a really clear pattern emerges. All three of these require lifelong management. And if someone with diabetes has a flare-up, we don't call them a failure. Addiction is exactly the same. A relapse is just a recurrence of symptoms, meaning the treatment approach just needs a slight adjustment. Setbacks do not erase progress. Another vital component of recovery for many people is MAT, or medications for addiction treatment. Now, there's a terrible myth out there that using prescription treatments like MAT is just replacing one addiction with another. That is entirely false. These medications are proven to save lives. They ease withdrawal symptoms to give the brain the space it desperately needs to recover, and they do not cause a high or impairment. They simply allow patients to work, drive, care for their families, and ultimately get their lives back. I want to leave you with this really powerful reality. People can and do recover from addiction every single day. Millions of Americans are thriving in recovery right now. We don't often hear their stories because of the exact stigma we've been dismantling today. But recovery is absolutely possible for everyone with the right treatment. So I'll leave you with this provocative thought. If millions are thriving in recovery right now, despite all these societal hurdles, how many more lives could we save if we simply replaced our collective judgment with science-backed compassion? Thanks for joining me for this explainer, and keep questioning what you think you know.